Hi, I'm Dr. Stephanie Marengo here on behalf of Coherent Health. As you know, Coherent Health is a digital platform that brings all health and wellness practitioners together to integrate care. We are hosting this series, Must Know, From My Modality to Yours, whereby we take an amazing practitioner from our platform to learn the top 1 to 3 things they want you to know to help benefit your clients. And today we have with us Esther Widlanski.
Hello.
Esther holds a clinical doctorate in physical therapy from Columbia University and undergraduate degrees in kinesiology and English from Indiana University. She was busy in college. She is deeply committed to supporting patients of all ages and genders who are experiencing pelvic floor dysfunction. She believes that her role is to foster healing through a collaborative, compassionate, and non-judgmental therapeutic relationship, and strives to provide individualized care to each person she works with. As a dancer, trained in classical ballet and contemporary dance, Esther brings a keen awareness of movement and mobility to her physical therapy practice. Before earning her doctorate, Esther worked for many years as a dance teacher and choreographer, and she holds a certification as a prenatal yoga instructor. Her professional life has primarily focused on guiding others in using their bodies safely and to their best individual ability. It was through experiences navigating her own injuries and those of her students that she became motivated to be of deeper service through physical therapy. Esther lives in Dobbs Ferry, loves reading, going to the theater, knitting, and spinning her own yarn. When she's not in the office, you may find her perusing wool on offer at local fiber festivals or crouch down to greet every single cute dog she passes in her neighborhood. Welcome, Esther.
Thank you so much.
It is a pleasure to have you. I would love to know more about your modality, which is physical therapy, your approach to it, as well as the top couple of things you think every practitioner should know from your modality to help theirs.
Yeah, absolutely. So pelvic floor physical therapy is just like any other type of physical therapy. We use all sorts of modalities, typically exercise. We use manual treatment. We use biofeedback, all sorts of things, lifestyle changes, modifications in order to get you a best health outcome. But I specialize particularly in everything sort of below the rib cage and above the knees. And typically that's a lot of stuff having to do with urinary function, bowel function, sexual health, cancer treatments often, like if you've had any kind of genital cancer, prostate cancer in men, or people who have prostates. Menopause is a concern. The list goes on, right? And what was the other question you asked?
Describing more about pelvic floor PT, because I think a lot of practitioners as well as clients just don't really know what it is, or let alone that it exists.
Yeah. Something I think, questions I get when people tell me they're going to go to pelvic floor physical therapy and they're nervous about it is like, what do you actually do? Do you actually like put your finger there? Well, and the answer is yes, we do. Treatment often takes place without underwear on because I have to be able to assess and treat those muscles in the pelvic floor. And those are the muscles like in the bowl of the pelvis. So in between your pubic bone and your sacrum, or your coccyx really, and in between your sit bones on the sides. So those muscles in that diamond that surround your genitals and your rectum and hold all of your pelvic organs, those are the muscles that I'm primarily treating. But I do that also by looking at the muscles on the outside of the hip, the abdomen, the back, in the legs, in the feet, even sometimes in the jaw and the neck.
Yeah, there's a lot going on there. It's always been very interesting to me that region we collectively refer to as the nether region. It be like linguistically even shrouded in darkness and push it to the side. So I love that you and your colleagues are working with it. And I'd love to hear what you think other practitioners should know to be able to help their clients in this way.
Absolutely. So the sort of 2 to 3 big things that I have to discuss with almost all of my patients. The first one is the relationship between tightness in those muscles and weakness in those muscles. So a lot of people are functionally weak in their pelvic floor because they're tight. And I think that sometimes when you hear tight or high tone, you think like, oh yeah, high tone, like burly, muscular, really fit, high functioning. But actually, if you think about it, like your muscle is maximally contracted and you want to create power over distance. So like if I'm talking about my bicep is all the way contracted and I go to reach for my mug over here, I can't do it. So I might as well not even have a bicep, right? Because if you can't relax, then you can't get the benefit of generating any power, force over distance, right? So functionally, a tight muscle can often be a very weak muscle. And so then we have to do the work to relax the muscle before we can strengthen it again.
I think that's a super important point that is missed, that tight is not strong. Those are two different things.
Absolutely. Absolutely. And the other thing about that, this is sort of my part two, is that you can't ever really know for sure if a muscle is tight or if a muscle is, maybe it's atrophied or it's overstretched, unless you've examined that muscle directly. So often I have a good idea if somebody is telling me, because you see patients and there becomes a pattern to some of the things that they say. And so you begin to suspect, oh yes, you're complaining of this thing, and this thing. I imagine that when I examine your muscles, I'm going to find a tight pelvic floor there. But sometimes you're surprised. Sometimes that's not the case at all. Sometimes the opposite is true too. When you are hearing someone talk about something and you think, oh, you probably have a lot of atrophy in your pelvic floor, or I bet you're super weak. And you go in there and it's like, oh, it's tight here. That's why you're having these symptoms. So it really could be either, but I have to examine those muscles directly. So if you haven't examined those muscles directly, you can't tell someone, well, you can, but you shouldn't tell someone, you need to build muscle strength in your pelvic floor, or, you need to relax your pelvic floor. Although the majority of us need to relax our pelvic floors.
Yeah, that's very true. I'm probably somebody who needs to relax her pelvic floor along with the rest of her body in general. But Kegels, as just a woman in this society, Kegels have been sold for a long time as the thing, as the remedy to do for your pelvic floor, no matter what. So I appreciate that you're bringing in nuance and not necessarily demystifying it, but giving it context.
Yeah, absolutely. I have had a ton of patients who come in with issues, especially like stress incontinence is a big one. People think if they have stress incontinence, they need to be strengthening their pelvic floor, and maybe another practitioner, and it could be even a doctor or a different kind of physical therapist, or maybe their yoga instructor or Pilates instructor, say, oh, you should do pelvic floor contractions, you should do Kegels to strengthen that. And then that made it worse, because typically stress incontinence, so that's like stress incontinence is you sneeze or cough or lift something heavy and you lose a little bit of urine or a lot of bit of urine, depending on how severe your stress incontinence is. Typically stress incontinence occurs when the muscles are too tight to function properly. And so you could be, by suggesting someone just do Kegels, you could be making their condition worse for them.
Makes sense. That makes sense. So tightness is not strength, it can be weakness. And don't just go about Kegling as the remedy to everything. Use it when indicated. These are awesome tips. Was that the half tip? Do we have another tip?
No, the other tip is like, you can't know unless you examine, right? So if something's going on in that area and you're not prepared to examine those muscles for whatever reason, either you're not qualified or you're not comfortable, those are both totally reasonable, wise to refer out to a pelvic floor physical therapist or a pelvic floor occupational therapist, a specialist who will look at those muscles and be able to really answer the question of what is going on here and what needs to be the plan of care for this patient.
And what are you seeing in terms of clients at a general level? For the other practitioners from different modalities, what can they be on the lookout for in terms of keywords or complaints that might help key them off to, oh, I wonder if the pelvic floor is involved here?
Yeah, that's a great question. So I think, if someone says to you, if someone's comfortable enough to say to you, like, oh, when I do that exercise, I pee a little bit. Well, then that's definitely pelvic floor dysfunction. But that won't always be what someone's volunteering to you, of course. If somebody tells you that they had a pretty painful annual exam at the gynecologist, that could also be pelvic floor dysfunction. That could indicate pain with penetration is not functional. So this is another sort of so boxy thing, but a lot of people have painful sex and they're not even really aware that they're experiencing discomfort because they just think that's what sex feels like, which is a real bummer. I hate to hear about that, but something that can sort of clue you in is if they also have pain with other types of penetration, like wearing sanitary products that are inserted like tampons or discs or cups, or if they feel pain with speculum exams, then that might clue you in that there's something going on there. Some other things are if you see a person typically has like jaw pain or is like a high stress kind of person. We all know those people who like cannot for the life of them sit still in savasana, or they're just, really go, 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 or they're type A people, just in general, the type of person who is a pleasure to have in class, like me. But these types of people have a hard time down training, and they also want to like really be high achieving. So these people typically hold a lot of tension, and that's a clue that there's pelvic floor dysfunction. And if they also have like a nagging hip problem or low back pain that just doesn't get better no matter what, no matter what they're doing for it, there's probably a missing piece there that's pelvic floor related.
Those are super helpful practical tips. Thank you. I'm going to jump on the lower back pain part for a minute because you are a tremendous physical therapist. You are a dancer. You know the body. Can you explain a bit more about just the pelvic floor and its connections? You said you take care of from the knees to below the diaphragm, but feel free to go to the feet, feel free to go to the top of the head. Why pelvic floor health is important, and at least musculoskeletally, how its important, how its health is important to the rest of a healthy body.
Absolutely. So you've asked such a rich question, and I could talk about it for hours. But sort of like to try to be a little bit brief about it. Almost all of our important functions pass through the pelvic floor. If you think about it, you've got voiding, right? You've got sexual function, but you've also got like a lot of major blood vessels that go through the pelvic floor. And it's the place where all the weight comes up through the floor to be managed when we're walking or doing any kind of impact activity. And also all the weight gets managed from the top down, right? That's really our support system. So if something's not right in your support system, then that can travel any place in the body. Also, you've got these enormous thick sheets of fascia that run from the jaw all the way down to the pelvic floor, and then in the back too, from the pelvic floor up along the spine. So you have just an enormous amount of connectivity from the pelvis to really everywhere else in the body. I don't work on wrists so much, but feet for sure, and jaws definitely, because if you think, you could probably even test it out yourself, or you might have heard, if you are a parent of a child who was at all constipated, you might have heard of moo to poo. That's actually something that I bring up with my constipated patients. Yeah, making a noise with your mouth can really help you relax your pelvic floor, get open so that you can void. So
Moo to poo. We just have to stop there for a moment and appreciate that.
Yeah, it's a helpful tip. I don't have a lot of success convincing my clients to moo, but sometimes they can be convinced to shh, which is also a way to get the jaw to relax a little bit and helps generate pressure to avoid the bowels. So that can be helpful. Just helpful hints from your friendly neighborhood physical therapist over here.
Tremendously helpful hint. I think that's the bonus round tip is moo to poo.
Yeah.
Of course, one can take liberties with what that sound might be, but we take such a structural, or we can take such a structural approach to the body and see the pelvic floor just as its own area and forget that it affects the jaws and it affects the feet. So it's not just a lot of good we're doing by helping the pelvic floor in and of itself, but we're really tuning up the whole physical form.
Yeah, absolutely. And I mean, of course, there's also a structural element too, right? Like there are muscles in the pelvic floor that I treat internally that I also treat externally that attach to your femur. And these that's easy to see why this is a hip muscle because it's a hip muscle, right? It's responsible for external rotation. And it's actually, that's your obturator internus. And it's the muscle that literally all of my patients get mad at me when I put my finger on it. Externally, internally, they're all just furious with me about it because it's an typically angry muscle. So yeah, you've got those connections, and then also like those muscles sometimes want to like take over for external muscles to try to create pelvic stability if you're missing it from somewhere. So like if you have really weak ankles or you have one ankle that has a history of sprain, then maybe that's changed the way you walk. So maybe that's changed the stability of your pelvis, and maybe that's uncomfortable for your body. And so your pelvic floor tries to compensate for that. That might be like a piece of this low back pain, right? You're using now a compensatory pattern. And so your back is involved or your hip is involved. And sometimes it's up one side of your body. It's like that's the side of your body that's unhappy and it goes from your ankle to your shoulder, or sometimes it like zigzags. The body is a weird and wonderful, mysterious place. So you can't, you have to take it person by person. It's not ever, that's very exciting. You get to everything's a puzzle and you get to try to figure it out with your patient, which is so great.
Every body is a singular body. Is there a place before we close up that you can recommend either online or a favorite anatomy textbook where your fellow practitioners can go to look to visualize the pelvic floor so they can have a visual sense of?
Yeah, actually, I'm trying to remember the name. I think it's My Pelvic Guru, maybe. I'm looking. Yeah, pelvicglobal.com. If you type in My Pelvic Guru or pelvicglobal.com, it'll take you to a website. They've got tons of free resources where you can just click through and you'll see a lot of really beautiful images of the pelvic floor. And you can also see they have a couple of really cool images of like, this is what it looks like when a finger is inserted and doing internal treatment. So you can really get a good sense of like, this is what happens during treatment. It's a very cool resource.
Wow, that is. Thank you. This has been very practical. We've learned tightness versus weakness. We've learned don't just Kegel all the time. We've learned all the different points of interconnectivity. Mooing. We have our PT Global resource. Thank you for being the pelvic floor physical therapy promo guru. The pelvic floor is all over. Thank you. No, but truly, thank you for your time and energy and knowledge, Esther.
It's absolutely my pleasure. Thank you so much for having me, Stephanie.
And all of our esteemed viewers, fellow practitioners, thank you for your time, energy, and receptivity. You can find Esther Widlanski. She is a real person. She is on the Coherent Health platform. Look her up, invite her to connect, find out more. You can also learn more in the text below, and we'll see you in the next episode.